name is Mary Hinches. I'm a 7th semester nursing student. Today is March 3rd, 2021, and I'm going to be administering meds through an NG tube. So hand hygiene, knock, 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 provide for privacy, introduce myself, and 2 patient identifiers. My name is Mary Hinches. I'm going to be your nurse today. Can I get your name and date of birth? Okay. And then, do you have any allergies that I need to know about? Okay, good. We have gathered supplies. Got everything I need. Got my 2 meds. So we're going to be giving you your Tylenol and your Zyrtec today, okay? But before we administer any feeds into it, we want to check its placement every time before we do that. So one way we could do that is through an x-ray, which would be ideal, and then the gastric contents, and then instilling the air. So we will check placement first. And he would be in a high Fowler's position. Okay, bed is raised to a working level. And I would make sure, the tape does not stick good to these mannequins. I would make sure that I have turned off the feeds or suctioning 30 minutes prior to this. And so we're gonna get our syringe. Kind of want to place a towel under here. It can be a little bit messy. Unclamp. Pull back, get some contents out. Hold that so it doesn't, residual doesn't come out. We'll put that in our basin on our pH strip. And I did get and we'll check that, and it's 5, so we're good. Each facility is different about if you should put this contents back in or if you should dispose of it, and my facility says put it back in, so I would re-administer the contents. I got about 5 ml out, put that back in, and leave that for a minute, put that down. Then we are going to check our placement another way through listening for the air. So I would pull out my air about 20 to 30 mLs. Unclamp. And listen for the whoosh. We know we're in the right spot. Okay, so then we can begin to do our meds. Like I said, I've checked his name and date of birth already, and then I would also scan my meds and check it to the MAR. Okay, do hand hygiene, some clean gloves. And then you always want to flush before and after each med with 20 mLs of sterile water. All right, doing okay, Mr. Jones? Okay, so I have my meds already crushed. Here. Got my syringe. And my sterile water in here. We're going to pull up 20 mLs of that sterile water and flush. Okay, Mr. Jones, we're just going to flush your tube and administer your Tylenol, okay, and your Zyrtec. Insert all of that. Okay, then we've got him flushed, so we're going to pull up our first med. Okay. Pull that air out, do it over my towel. Okay, now that we've got all the air out, we can also wanted to get 20 mLs again and flush that med just to make sure it all got in there. Flush again with my sterile water. Then we can do our last med. So get that pulled up. Then I'll go ahead and administer. Okay, got that in, got the air out. And we can then do our last flush. So get my 20 mLs of sterile water again. And make sure I get the air out of that. Make sure it's just the water, and then we're good to go again. Okay, then we want to clamp that, make sure we don't have any leakage. And we'd want to have him, if he can, sit up in a high Fowler's position afterwards, and then we would keep TPN, or not TPN, feeds and suctioning off for about 30 to 45 minutes after we've administered this. Clean up my area. Get that away, and then I'd want to do hand hygiene again and document the meds I administered, how we tolerated it, the contents, the characteristics of the contents that I got, how much sterile water I instilled, how I checked placement, and then just how much I flushed and everything like that. And then we are good.